Here we go. March 24th, 2020, the City Council will meet in City Council chambers on Tuesday, March 26, 2020 at 7 p.m. to hold its regular meeting for the purpose of discussing any and all business via remote participation in accordance with Chapter 40 of the Massachusetts General Laws and the Governor Baker's emergency order dated March 12, 2020. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law 30A, Section 18, and Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Salem City Council will be conducted via remote participation. No in-person attendance. Public will be permitted, but every effort to ensure the public can adequately access the proceedings in real time via technology means. In the event that we are unable to do so in matters not requiring a public hearing, we will post on the city's website an audio or video recording, transcript, or other comprehensive record of the proceedings as soon as possible after the meeting. Individuals may participate remotely in the meeting via remote participations platform called Zoom. And anyone who is watching this via Zoom or on SATV sees everyone who's here right now. And if you are watching on SATV and you'd like to enter via the link, it's on the city's website. Right now, the regular meeting of the City Council will be held in council chambers on Thursday, March 26, 2020 at 7 p.m. for the purpose of transacting any and all business. Note of this meeting was posted on March 24, 2020 at 1:24 p.m. This meeting is being taped, is live on SATV and on the Zoom platform. Currently, all councilors are present. Council President McCarthy presiding. Councilor Terrio moves to dispense with the reading of the previous minutes. All those in favor? All those opposed? We all join Councilor Flynn with the Pledge of Allegiance.
I pledge allegiance to the flag
of
the United States
of the United States of
America,
to the republic
for which it stands, one nation, under God,
indivisible,
with liberty
and
justice for all.
Justice for all. Thank you. Councilor Terrio.
Thank you, Mr. President. I'd like to move for a point of personal privilege, please.
Councilor Terrio.
Thank you. I'd like to take a moment to remember William Kelly. He was the Ward 5 councilor in the late 1990s for 2 terms. He passed away on March 10th at age 81. Bill's arrangements were private due to the health emergency. His family does plan to hold a celebration for him at a future date, and I'd like to ask us for a moment of silence in honor of Councilor Kelly.
In addition to that, Councilor Dominguez is
Thank you.
Thank you. For some reason, we just had a little technical glitch. Councilor Terrio has asked for a moment of silence in addition to Kelly, who was a city council for 2 terms. Councilor Dominguez. In our community, that we also rise with a moment of silence for them as well. So we're going to have a moment of silence. Thank you. At this point, Public testimony, none. I now recognize Councilor Dibble.
Thank you, Mr. President. I move that we take the agenda out of order and move to page 11 to allow the mayor to speak.
Councilor Dibble moves to go out of order. Page 11. Seeing no objection, Councilor Dibble.
Communication from the mayor to address the city council March 26, 2020 to provide the public and the council with an update on the city's response to the COVID-19 outbreak.
Councilor Dibble moves that this be received and filed. That being said, Mayor Driscoll.
Thanks, everyone. I appreciate the opportunity to come before you this evening remotely, and I just want to note your first official virtual remote meeting and for the city of Salem. So great job pulling that off. I am going to be joined by Dave Greenbaum. I think he's having a little difficulty logging in, but as soon as he does, we can certainly also share questions with him.
I'm on, Mayor.
Oh, great, Dave, you're on. Fantastic. Thanks. We've put together just a brief PowerPoint to provide an update to you and anybody who is listening along. So I'm going to go ahead and share the screen, and hopefully you'll get this up. Can folks see that on their screen?
Yeah.
No.
Anybody got it?
Not yet.
Not yet.
Okay. Hang on, guys. Let me, okay. How about now?
Getting there. Yep.
There you go.
Yes.
All right. Okay. Good?
Yep.
All right, so we did put together a brief update and thought we would just run through some of the latest statistics. Unfortunately, our cases in the city of Salem are on the rise. We've got 14 currently positive cases in Salem. One of those individuals is hospitalized. Dave, do you want to go through any of those other numbers? We've been doing regular health updates. You're better at it than I am at this point.
Yeah, so like the mayor said, we do have 14 confirmed cases in Salem, one of which is in the hospital. In Essex County, we have 247 cases. In Massachusetts as a whole, there's 2,417 cases. Those are cases that have been tested and come up positive, whether that be at CDC or one of the other testing sites around the state, including the state lab and Quadrant and laboratories like that.
There is a process that the Board of Health and the public health nurse are asking folks to follow. And maybe you can just run through that for anybody who might be following along at home, Dave, what the process would be if they're feeling ill.
Sure. So if a patient exhibits symptoms, the orders are to self-isolate at home, or if the patient is hospitalized, then they'll be hospitalized if necessary. If the healthcare provider determines that based on symptoms, medical and work history, and any known exposures to a COVID-19 case, the patient meets the criteria and the provider will order a test and instruct the patient where to go for testing. That's actually very rare right now. The tests are so tough to get that they're really restricted into healthcare workers and frontline personnel like police, fire, and EMS that are actually dealing with the patients on those front lines. So if we get a positive result, it's reported to the city's public health nurse through the Massachusetts Virtual Epidemiological Network, also known as MAVEN, and she does all the trace back and investigation through that system. All the contacts of positive COVID-19 patients are quarantined at home for 14 days. The public health nurse supervises them by phone, and if symptoms develop, they consult with the public health nurse, healthcare provider. The patient may be tested or clinically diagnosed and remains under isolation. So if the healthcare provider determines that they don't think that there's a need for a test, they're just going to determine that they are positive, then that would be the route that the healthcare provider would go. Anybody inside the house that, is a direct contact of that patient, they would be required to self-isolate or self-quarantine for 14 days. And then if they showed symptoms, they'd go through the same process.
And Dave, can you just run through what people do if they are tested positive, how Suzanne is chasing down any contacts?
Yep, so she reaches out to them by phone, tries to trace back anybody that they may have had contact since the date of onset of symptoms. So if symptoms onset today, she would want to know who that person had close contact with during that day. If onset, conversely, if it was 3 days ago, so she would go back 3 days for trace back the contacts. And those contacts would be required to self-quarantine at home unless the doctor deemed they needed to be hospitalized for 14 days.
Great, thanks, Dave.
Yep.
So far in terms of how the city's looked at this particular virus, we've put together a COVID response team, and I thought we'd walk through some of that. I know we shared some of this information with counselors already. Because of the number of cases that we have of confirmed positives, we are looking to provide additional public health nursing support. Suzanne has done an amazing job, but with 14 people and needing to chase down all of their close contacts, it's really, and the regular monitoring of that, we really feel like it's important to have some additional assistance. So that is in the works. We have obviously shut down both school and city facilities. The buildings are right now operating with just essential personnel, but people are working remotely. So if you are calling or emailing or using an online service, you will get a response. It may not happen right away, but people are working from home to try and address needs that residents may have. We've launched Salem Together, sort of a clearinghouse to coordinate community resources. We'll talk a little bit more about that. Although the Community Life Center is closed, the COA is still providing social work. The social workers there are really doing some terrific work, reaching out particularly to our most vulnerable seniors. We are working closely with meals. Anyone who received a congregate meal is now getting a meal delivered to them. And we're still providing transportation services. So that means we are taking seniors to medical appointments and to groceries, things that are critical for them in terms of getting items that they may need, as well as providing options for anyone not to go out, which frankly we'd really prefer. We have declared a local emergency, both the mayor's office and the Board of Health, and that will enable us to certainly be at the front of the line should there be any additional assistance coming, which we hope and expect at the state and federal level. And the Board of Health emergency enables them to ensure that personal service businesses, this would be hair salons, nail salons, anything that really couldn't maintain a close social distance or couldn't maintain a safe social distance, that those would be curtailed. We have activated the incident command system for emergency response. The EOC would be at the police station, the emergency operations center. That's set up and ready to go. And we are looking, as you know, on this council's agenda for an appropriation of $250,000 to put as part of into a fund for our COVID response planning efforts. Things like the hiring of additional public health nurses, additional equipment, PPE equipment that we're going to need, and support for these COVID response specific teams. I've mentioned to the council sort of the way we're organizing ourselves to think about coordination and planning into several different teams. Each team has a different leader. So we're focused on our most vulnerable populations. Anyone with food insecurities is being headed up. The team is being headed up by Carrie Murphy. They are really rocking and rolling. The school department's doing amazing work. We've served, I think, over 12,000 meals at this point to Salem school children. We're also delivering meals to many seniors in any of our subsidized housing complexes with our partnership with Root. There's also a group wanting to be concerned about our senior population, who we know are at a higher risk for the coronavirus. The senior population team is being led by Dave Greenbaum. This is reaching out to nursing homes, elder care facilities, making sure we're in constant contact with them if they need additional resources and to better understand how we can troubleshoot any issues that they have. Our homeless population, that team is being led by Chief Butler. This is probably our biggest pain point. LifeBridge is a pretty small facility. There are 50 beds there. At this time, there's about 30 individuals residing there. It's really difficult to maintain safe distancing in that population and within that particular setting. We are working closely to identify a quarantine site for the homeless population. In all likelihood, it will be a regional facility. LifeBridge also runs the facility in Beverly, the River House. And we're also heard from the city of Lynn about their needs for their homeless population. So we are working hard to identify a site that can be used for a quarantine location should any homeless individual test positive or even be presumed positive. You really have a situation there with the close living quarters that could be quite at risk. So that is a top priority. Group homes, we've asked Chief Jinta and his team to lead up making sure we have contacts. This would be Northeast Arc, Plummer Home, any of our homes that have group populations in them that may need additional support at this time. We want to make sure they have proper access to supplies and equipment. Our English as a second language and immigrant population is being headed up by Laura Assad in my office, and that's really using the networks of existing organizations, individuals with connections to immigrant populations, those who may feel that they're not comfortable with the language, aren't really sure where the resources are. Again, we want to make sure we're communicating with as many individuals as possible. Groceries, pharmacies, and retailers, never expected that these folks would be put in the position they are as really essential employees. And so we want to make sure we're supporting them and that we're also mindful of the practices they're using. You're thinking about exchanging dollars and the processing of goods, the supply chain, how things are coming in. Dave Greenbaum is heading up that group. Volunteer coordination is being led by Emily Ullman out of the school department, and she's really helping run Salem.com together and serving as a clearinghouse in an effort to make sure we're matching people who might have needs with many people who have said they have time or resources to volunteer. The Economic Development, Recovery, and Revitalization team is being led by Tom Daniel, the city's Planning and Economic and Development Director. And they are really working hard to understand what the needs are. So a survey has gone out to the business community, trying to understand how we can be most helpful. And as we think about these state and federal resources, really going through those different programs and trying to make sure businesses here know exactly how they can get a hold of resources as they become available. The three other teams are really more focused on communication. We want to make sure that we have a firm pipeline with North Shore Community Health Center, with North Shore Community Health Center, North Shore Medical Center, or other healthcare providers in town. We've got large doctors' offices, pediatricians that are still operating, and we should be in communication to troubleshoot any issues, along with major employers, many of whom do qualify as essential employees, so they are still working. And then the interfaith community, a little disconnected without people really being able to attend mass or services, but we know the interfaith community here has always been one we can rely on when we're thinking about communicating with individuals, recovery, and some of the connections that folks are used to making in this community in terms of serving others. I should point out, I mentioned all of the leads. These are really team efforts. So, there's a whole collection of people both internally in the city as well as partners, partner agencies that have been engaged in our community that we rely on, that are part of these efforts. These folks just got up and running this week. So many of them will be reaching out, I think, to you and others in our community, asking for help, developing strategies, and trying to make sure that we don't have folks falling through the cracks. Unfortunately, I think this current condition is going to be with us for a while. We know schools are closed till May 4th. I don't know how long the stay-in-place order is going to be in effect, but certainly there's going to be impacts for many weeks, if not months. And I think we're trying to make sure we're organized in a way to try and attack issues as they arise, and also be ready for thinking about recovery, revitalization, and how we kind of chart that path forward. I'm going to keep going. It's probably easier, given the medium, to do questions at the end, if that works for members of the council. So in terms of Salem Together, not surprising to anybody on the city council, we have so many people who have really stepped up and been willing to give their time and their talents to their Salem community. We really thought it was important, given the unprecedented nature of what we're facing, that we have a clearinghouse for resources. So Salem Together was formed. It's a page on the website that has health resources, information on charitable funds. If you need assistance of any sort within our community, there's usually resources that have been supporting some of those efforts. I mean, we had a vulnerable population before all of this took place. So we want to make sure people know where those resources are. It may not have been something that people needed to connect with in the past, but they may need to now. We've also got the information on food service distribution. I got to say, the food programs are really rocking and rolling. The school food services department, led by Deb Jeffers and her really talented team, have just hit the ground running and delivered meals at 14 different locations. Root has been an incredible partner, really stepped up to cook and deliver meals to go for seniors in our senior subsidized housing complexes, and that effort's really growing. And both the Salem Food Pantry and Citizen Inn are serving more and more families in Salem, probably more than they ever thought they would, and we really want to try and support those efforts. So Salem Together has also got over 400 people signed up to volunteer, and there's some shortcuts if you just need an ask or you just need an offer. We're encouraging people to go to that website, especially given the duration of how things are going to go. We know we're going to need to lean on each other during this time. This week feels a little bit like a novelty, being alone in City Hall or not many people here, but as this goes on, I think we're going to really need to work together to overcome a lot of the challenges that people are going to be facing. Within the schools, as I've mentioned, the food services program is running strong. They have delivered a ton of meals and are working really hard. Remote learning is a very robust process right now. We're distributing Chromebooks. We have distributed Chromebooks to all middle and high school students. I should say we're trying to distribute them because we've still got a block of students who we haven't connected with. To anyone who may be listening or following along, we really need to get in touch with all our middle and high school students. If they have not contacted their schools, please ask them to do so. We have, I think, 200 laptops, Chromebooks, that typically belong to students. We have a one-to-one program, so all of our high school students and all of our middle school students have their own Chromebook. Many of them were left at school when students were at home, and some of the middle school ages, they sort of keep them at school. So we want to make sure they have them because we've got a pretty robust site up and opportunities for learning online. We know that's going to be important, especially given the fact that schools closed all the way through May 4th. I know teachers, principals, school officials are really working hard to think about how we can provide students an opportunity to learn, trying not to overwhelm parents. It's a lot taking on somewhat of a homeschool nurturing opportunity, and also want to make sure that our scholars have access to this information. So the Chromebooks are key. If you, again, know a middle school or a high school student and they have not been in touch with their principal or their teacher, we are trying to get a hold of every middle and high school student. And I said we've got a couple hundred that don't have their Chromebooks and we want to get them to them. In terms of special education and therapeutic services, a number of students receive services through the schools. Our special ed teams are contacting families directly to assess their needs and work with providers to make sure we're continuing therapeutic services during the school closure. A lot of that is tricky with this order, a stay-at-home order. So it's still a work in progress, but there certainly is a desire to make sure our students and families are being supported while they're not in school. And our homeless students, this is a group that we're really trying to work closely with, ideally to try and support finding a home. It's difficult to manage this stay-at-home order and no school all day in our settings, and many of us are fortunate to have warm homes and full fridges. We do have a number of homeless families who are either in motels or shelters or double and tripled up, and that's a really hard slog if you've got a whole bunch of kids and they're home all day and you don't have necessarily the space that you might need. So we are trying to find some additional supports within our community. If folks do have units that are available, rental properties, apartments that are currently vacant, we have families that we will support to put into those units because it's just so critical that they have the space they need, especially given everything that folks are facing for the next month for sure, but even longer. So some of the common questions, I know Dave is on, and we thought we would try and make sure you were aware of some of the questions that we get and what might be on folks' minds. So Dave, why don't I turn over at least how do I get tested to you? You touched upon it a little bit, but if there's anything more you want to add there.
Yeah, so we do get a lot of questions about how you get tested. And like I said previously, right now, the most people that are getting tested are your healthcare providers, your frontline employees, your first responders, and things like that. They're really trying to make sure that first the healthcare providers rather are tested so that if, they don't want to lose that staff in the hospital. So we're telling people they really have to talk to their primary care physician. If their primary care physician feels it's necessary for them to be tested, they will order the test and tell them where to go to get it. That's really the only way anybody can get tested at this point. You can't just walk into Salem Hospital, into the emergency department. I don't even think I think they were operating with 2 doors. They may have locked one of those now at this point, and everybody has to go through the emergency department. But they're stopping you before you even get in, and they're asking you, why are you here? And checking you for symptoms outside the main doors to the emergency department, because they don't want sick people going in. So getting tested is very difficult. It has broadened some, but it's not as widespread as I would like to see personally.
So next one, why are we remaining at home? Obviously, we're trying to limit any contact with individuals so that we can flatten this curve. We don't want to overwhelm the healthcare industry. And at this point, at the rate we're at, we're on a track to do that. So folks can stay at home and only go out if they really do need those essential services. Dave, why don't you talk a little bit about which businesses are essential? And we have been referring folks to you to answer that, even though the governor sort of issued the order.
So when the governor issued his stay-at-home advisory, he put in a large list of businesses, employees who would be exempt as essential. So it's wide-ranging. It's very hard to interpret from my point of view. So we're taking them and we're looking at the order very closely to see where they may fit in to some of those exemptions. And if they don't fit in, then we're telling them they can do, they have to close under the order. However, part of that advisory from the governor, at the end, they can apply for status as an exemption or as an essential employee. So we're advising them to do that if they feel that their particular profession they feel is essential. So, we don't want to put people out of business. We don't want to close them down, but we really want to limit the amount of people that are in the community out and about right now to try and, as the mayor said, flatten this curve, because it's really the only way this is going to happen. So if people feel like there is something out there that isn't listed as essential that should be, they should apply to the state for that designation as an essential business.
We do know that there are some businesses that were not deemed essential that have been moved into that category. Bike shops come to mind as one that the governor added to the essential list. So that there is a process if you feel as though your business is not listed and should be. We are directing folks who might need help with housing, childcare, food to the Salem.com Together site. Housing and childcare is probably harder than food right now, but we do think it's a resource area, and if you need that assistance, it's probably better for us to know than not know and see what we might be able to do in the short term. For anyone who's lost their job, the state is expanded widely the unemployment requirements. They're recommending everybody use the online unemployment insurance sign-up process. The call center has been jammed. They had 20,000 people in one day sign up, so it's a little bit tough to reach via phone. But if you do call and leave a message, they are calling people back. I do know that. It's taken them a few days. But the best suggestion is online. And if you watch the governor's presser today, he mentioned you really need to know who your employer is when you begin your online process. And by who your employer, it's who's listed on your W-2. Because sometimes who your employer might be may have a different sort of corporate name on your W-2. For folks who are owning a business, we are putting together the collection of resources. Right now, it's primarily loans, SBA loans and bridge loans. We are hopeful that with the state and federal relief packages that are coming, there are going to be additional resources that might include grants. How can you donate or volunteer? Again, salem.com/together is the place we're trying to have as a clearinghouse. And when will this end? Well, school is closed till May 4th, if that gives you any indication. I was speaking with some members of the business community today. I think it was Brian Kennedy who told me that Penn is planning on July as an opening date. And I think everyone is trying to have their best estimate as to when. But it certainly is weeks and potentially months at this point is our best estimate moving forward. So I think I'll pause there. I'm sorry for the link to that. It might be easier to get everything out and then take questions if there are any or comments individually. Counselor. Domingo, I think you're going to have to unmute. I'll stop sharing now, and happy to answer any questions.
Thank you, Mayor. I'm very happy to see everyone. So beautiful. And thank you for the great explanation. I think that you cover most of the things that we're looking for. And my concern is about, we're sharing the hospital from other cities. How do you come out with 14 positive people from Salem? Or you manage the whole total numbers of what are tested in the hospital and being positive for the whole community? Because I know the numbers seem to be very low. According to the news, it's been bigger than that. But we just wanted, for the purpose of getting the community to know exactly where we are. Can you share those numbers, exactly how many positive cases do we have in Salem Hospital?
Dave, do you know that? We get information on the number of Salem residents.
Right. So yeah, we don't get the numbers for other communities. The only thing I can say is that in Essex County as a whole, the total as of today was 247. But that, Essex County goes from Lawrence, Haverhill, all the way as far as Lynn. So it's hard to say how many of those would be specifically tested positive from Salem, except for the 14 that we're made aware of. Unfortunately, we don't get those other numbers. They don't tell us how many people they've tested and how many are negative. I mean, obviously we have 14, so I assume the rest are negative, but we don't get the rest of those numbers from Marblehead, Swampscott, Lynn, Peabody, and things like that. So unfortunately, I can't give you that information.
Domingo, I can share with you that I did speak with Dr. Roberts over the weekend. We've talked frequently, but not specifically about numbers. And over the weekend, they actually had a lot of capacity in the hospital. They were not there were not high numbers of folks being hospitalized at North Shore Medical Center or Salem Hospital. Now, I haven't spoken with him this week about this topic, so I'm sure that has changed and the numbers might be going up. But I can try and get that information for you. But 14, it was 8 yesterday in Salem, and it's 14 today. So the modeling of how this is increasing is what we're really trying to take a look at. And that's, for us, not something we want to see continuing, almost a doubling on a daily basis.
I do understand, Mayor, and if I may, Mr. President, for you.
Yep.
I do understand you answered pretty good, but my concern is that the capacity that we have in Salem, for some reason, if things started to escalate to a number, we're going to be having less chance for the residents of Salem to get treatment. So I think it's important for us to know exactly what are the real numbers based on the hospital that is located here in Salem. Because if we actually just project that number, 14 people out of 48,000, people might think that the crisis, they're going to take a lightly. So I think it's good to know exactly what we have in Salem as a base, and then we can move forward. And I have another question, if I may.
Sure.
When you mentioned the list of the essential businesses, it's possible that City of Salem can come with an actual list, because as I hear from you and from the governor, there is a list, which is a big list. But remember, we are a very small city. We have different businesses, maybe mom and pop, that are not the same as might be in a big city. So it is possible that the City of Salem made their own list of what would be the essential businesses that still open. For example, we have the taxis drivers right now. I just received a call from them. They wanted to know if they can continue to operate or not. It's something that I think the city needs to address, making sure that they know they can continue to make the risk of working, providing the service, or stop doing the service. So my question for you, be clear, is can the City of Salem make their own list of what are the essential businesses that need to be open at this point?
Sure. The list that we're following is the same as the governor's, and I think we have that on the city's website under our COVID-19 response tab, but we can also get it to you, Councilor. It's a breakdown of any business. It is a few pages. It's fairly broad what's considered an essential business. But if anybody has any questions, the health department locally is the group that is making the deliberation as to whether or not, or decision whether or not something is or is not an essential business under the governor's order. Some things are really clear cut, but others, if there are queries, that's where we should send them. We will not have our own separate list. We will work off of the governor's list. We're not going to further dwindle down those essential businesses, and we're going to use that. It really doesn't make any sense for Salem to do something different and have 351 cities and towns with different essential businesses. So we're going to keep it consistent. But we can get you the list for sure.
Thank you. Yeah.
Councilor Hapworth, then Councilor Madore.
Thank you, Mr. President. And thank you, Mayor, and thank you. We're super appreciative of everything the city's been doing here in the last 2 weeks. My kids are appreciative of the Lunchables they've been getting, probably less appreciative of the homework they've been getting, but it's been, fairly smooth as far as best we could ask for, I think, right now. So really appreciate that. 2 questions, just one, I guess, in the near term, and then one that I hope we can maybe think about longer term if it goes a little bit further. The first one is, I'm not sure if it was mentioned, but playgrounds, basketball courts, there's a lot of concern around the community right now, and I'm hearing a lot about, and I'm seeing a lot of people not abiding by the playgrounds being shut down. I can look out my window and see the common playground, people on it. We see kids playing basketball at times. Is there any ability to enforce there? Because I'm not sure where that goes. If it's just a suggestion they shut down, or if it's something that we can actually enforce as a city.
Yeah, they are shut down. So all of the parks have been signed. Anything with a play structure actually has signpost in it saying, closed due to COVID-19. And unfortunately, if folks are still utilizing that with those signs, you can feel free to call the Board of Health. We haven't really engaged with getting the police department involved in enforcing this, but we certainly could. They're probably more adept at trying to respond. With respect to the basketball courts, I think folks are pretty good, but with the nicer weather, it's just getting harder. So we're probably going to end up just taking the hoops down in the short term, or finding some other way to really prevent them from being used. As much as it pains me to do that as a former hoop player myself, it feels sacrilegious, but we can't really have a whole group. If it's one person, that's a little different, but even still, we're going to have to take some additional actions. There are some communities that have put sort of caution tape around their play structures to really, send the message home. We could probably amp up our efforts and do that, but it's pretty well signed at the Common in particular. And if folks are still doing that, just please call. Dave, do you have would you prefer them to call you, or how do you want to handle that in terms of enforcement?
I think that they can call us. It might be helpful if people notify Park and Rec as well, just so that they're aware that people are still using them. They really have the authority to close, and we can certainly do our best to enforce it. I just remind everybody that we are working on reduced staffing levels, so we may not get out there that day, but we'll try and get out there as quickly as we can.
Okay, good to know. And then I guess a longer term question is, as it gets nicer out, I know other communities have looked at larger cities have looked at concerns around social distancing on the streets. New York, I think, is looking at shutting down some streets potentially to allow for greater pedestrian access, or allow people to keep some space from each other. I'm not sure if that'll be a concern in Salem as we get into the summer months. We're going to have, I'm sure, less tourists, less people coming into the city. But just wondering if that's something we've concerned, and then also if we've considered, and then also places like Winter Island, places that can get a little busier in the summer. Just wondering, assuming that maybe it's not your first priority right now, and there's other things we're getting off the ground, but just things that I think we should potentially think about as we move forward.
Yeah, I think those are good points. I mean, right now it's pretty quiet downtown. I'm sure you're seeing that. The Ped Mall and other places, there are not lots of large crowds gathering. As the weather gets warmer, I think it's going to be more of a challenge. So I think we'll have to develop strategies if we're still at this for that period of time, for sure. And those things I would say would be on the table.
Sure. Thank you.
Sure.
Councilor Madore, then Councilor Dibble, and then Councilor Riccardi.
Thank you, Mr. President. Can everyone hear me?
Yep.
For you, to the mayor, thank you, and Dave, for all the work you're doing. I know you're probably not getting the kind of rest that you deserve these days. But I do have a question about unemployment assistance. I think a lot of the service industry workers they are not prepared to be unemployed overnight without any notice. So many of them are filling out these unemployment claims for the first time in their lives. And the system is pretty difficult to navigate for a first-time user, and without level staffing at the state level to provide direct assistance. I wonder if through the Salem.com Together volunteer call for volunteers, have you noticed if anyone has volunteered to provide that kind of assistance, that maybe at the local level we have people who are actually well versed in the system to help out?
Yeah, I don't know that we have definitely identified that. I can certainly check with Emily, who's running point on that, but I think what we could probably do is also put out a call, for anyone who may have some experience in this and who may want to give some guidance to somebody else to walk them through it. I know I have a local officials call tomorrow, and I can put that on my list to talk with the governor, lieutenant governor about as well. And I think in speaking with Rep. Tucker and Senator Lovely, they were talking about some, they were going to be running like virtual town halls on how to apply for unemployment and walk people through the system a little bit more. So we'll try and get those resources out too.
And my second and final question is, many of the business owners, smaller business owners downtown, they are very nervous about evictions. And I know that I know that we currently have a bill going through the State House for moratorium on residential evictions, but it doesn't expand to commercial. And I've shared that concern with our rep as well. And I wonder if, rather than the city sending the message that we encourage commercial landlords to be more flexible in collecting rent for the next few months, is there something that we can be doing more proactively or more assertive in asking landlords to help out with the rent for these next few months?
Yeah, we're definitely working on that as part of the Economic Development, Recovery, and Revitalization team. I've got Tom and Kate brainstorming ideas for what we might be able to do. And we definitely want to pull together. We're fortunate that we have a solid block of commercial landlords that we work with on other ways, usually on programs that are revitalizing streets. So we have contacts, we know who they are. We definitely want to reach out to them and work together to try and overcome this. I mean, it's in their best interest and our best interest to have a bustling and thriving downtown. And we need some time to get there, right? So we're trying to identify how we can be helpful, what role we can play, and with that in achieving that outcome. So stay tuned. As we come up with strategies, we'll be in touch for sure.
You all set, Council? Council Dibble.
Yes, thank you, Mr. President. Mayor, I think we're lucky to have you leading our city right now. This is uncharted waters. I mean, you went through no training to be at this point. So along with you, our health agent, Dave, thank you for what you're doing. Even Council President McCarthy, you're doing a great job. Our governor and our President Trump. I think that all of our leadership, they're doing the best that they can. Nobody went to school to learn how to do this. So nice job, everybody. I'd like to follow up on Councilor Hapworth's comments about the spacing, the social spacing that we're not seeing in different places, the playgrounds. And I like the idea of taking down the hoops on at least some of the courts that are avoiding that requirement of social spacing. Mayor, I sent you a note, and I got an email back from our council president about the lack of social spacing, the lack of 6-foot spacing in some of our food lines. It seemed like there was just crowding when people were picking up their meals. And if we can do some signage or some rules explaining the need to separate, we need to do a better job on that. Those are our most vulnerable residents, and they could use that hand. So if we can implement that 6-foot spacing at the place that we're handing out the meals.
Sure, absolutely.
The numbers at Salem Hospital are higher, and it seems like the 14-person number that you're giving out, that's numbers of Salem residents. And at Salem Hospital, there's many other unfortunately, patients that are coming from other communities into the hospital. So there's more than that. It's not overloaded at this point. There's still room there, but people should stay away. If they just have some small issue, some small health issue, a cold, something small, they should not go to the hospital. That's obvious. Mayor, later today, and you touched upon it earlier in your presentation just now, you're asking for $250,000 for Salem monies to meet some of our COVID-19 needs that are arising. But you cited in very fast fashion here today a list of starting with public health nurses to be hired to work with our health agent. I think it's a great idea. But in your letter, the list that you rattled off, and I'm going to ask you at the end of this to rattle that list off again. But in your letter, you didn't talk about anything in specific. You did write immediate need for expenditures to make and to support critical agencies and services. But those were immediate needs, you said, but you didn't say what those needs were or who they were going to, where the money was going to go to. Can you recap that again so I'm more comfortable where the $250,000 will go to?
Yeah, sure. And I want to be clear. We don't have a list of $250,000 of expenditures right now, but I do feel like we are going to need to have that nimbleness to operate and provide relief as necessary moving forward. Some of those would be to purchase additional protective equipment for public safety, for nonprofits that we have, the shelter, for instance, other places that need equipment. That getting it is one thing, paying for it's a whole other thing. Additional personnel, as I mentioned, to help and support public health work. Additional personnel for custodian work, cleaning, sanitizing buildings. We've spent some extra resources there and we'll probably continue to. This building, public buildings are still being disinfected because people are in them. Fire stations, the police station, things like that. And in addition, I think we may have to help stand up some of our nonprofits. Food pantry may need resources. There are going to be times when we're going to have to help subsidize some of the meals to the vulnerable senior and disabled population. So this pot of money for us would be a resource to try and address COVID-19 response needs and have the flexibility to do it right away. And of course, we'll provide accounting to the council of all those dollars, but it's really front loading some resources so we'll have them when we need them elsewhere. And those are some examples.
Great, thank you. That was my next question. You've addressed them all. Thank you so much for what you're doing.
Thank you, Councilor. Councilor Riccardi.
Thank you, Mr. President. And I'd like to echo the thanks towards the city, towards the mayor, towards the health department. Just an amazing job for a very unusual situation that we are all going through. So we appreciate the efforts. And a lot of my questions that I had have already been asked and answered. So I'll just kind of reiterate one that I'm hearing a lot from the ward because we do have a lot of, great open spaces and public playgrounds in the area. Playgrounds that have one sign hanging up when there are multiple parts of entry and points of entry. People just don't see it, and I'm just really concerned with the nice weather that's coming up. The full caution tape, we can screw it around or something. It is a big concern because the little signs are not very effective at the smaller playgrounds. And I know we have a lot in the city, over 30 parks, so it's a big job. But with the nice weather coming up, if this is something that we really need to make sure that we're doing proper social distancing, we need to make sure that people understand that a playground structure is also not a safe environment to be on. One wouldn't intuitively think that because it's outside. So I think we really need to get better with our signage and our advisories there. And all of my other questions were answered, so I'll just leave it at that. Thank you.
Great. Thanks for that. We'll try and reinforce it. We'll regroup tomorrow to see what we can do because if it's a nice weekend, it's a little bit harder to get resources too. And thanks for the bear hunt. That was a nice welcome relief in North Salem for I think a lot of families.
Yeah, good to share the smiles too.
Yep.
Councilor Prosnowski.
I think that with all the bad news, I guess you can call it, that's been coming out of this growing problem, we should also take a look and see if we can find some bright spots in what's going on. I don't hear any numbers on people that have gotten it and recovered. I don't know whether or not the Salem Hospital is releasing any information about people who've recovered and now are being tested negative. how long is this, after it enters your system, how long is it, if it goes through you, how long does that usually take? And it would just be nice to hear that there is also a recovery period. So, a little glimmer of hope as far as, okay, we've had this many cases in Salem, but we've also had this many cases of people who survived it, and we've released them, and they're COVID free and out in public again. So I just think that we should be taking a look at both sides.
Dave, can you share info on that? I know we've got a few folks who are in recovery, correct?
Yeah, so all the patients that we have, aside from the one that's hospital, is home, and they are home and recovering. So 13 out of 14 are at home and recovering. We expect that they will recover and be healthy after that. The federal government puts out an update daily that I can forward to the council through the mayor if people would like, that gives a lot more numbers, not just locally and statewide, but also federally. And I want to just touch on one point around the testing. Unfortunately, in general, there aren't enough tests for people to get, and that's why I think the numbers for testing are so low. You do see the positives going up because those people that are getting tested are testing positive. But if there was widespread testing, I think those numbers would probably be 3 to 4 to 10-fold what they are today. So like the mayor said, I think going from 8 yesterday to 14 today is a forebearer of what's to come tomorrow, the next day, and into next week. So I think that's an important point to make.
You all set, Councilor Prosnowski? What, I just lose everybody?
No, you got us.
Okay. Councilor Prosnowski, you all set? Maybe it's just Councilor Prosnowski. Anyone else, Councilor Sargent? No questions? I think no one's got a question. Anyone else's question for the mayor? Councilor Flynn, are you all set? Councilor Dominguez has his hand up one more time. Councilor Dominguez.
Yes, I just wanted to continue to echo the great job that the mayor and her administration and the health department have done. But I just wanted also to make sure that we not only work for now. I think that, as you hear in the news, the situation may escalate. Maybe the next week is going to be the most important for us to continue to. So I like to see a little bit more of the communication piece. I know that you name many of the places that need to be contacted. Is there any way that you can circulate that list of people in charge on each of the department that you just mentioned, so we can spread it a little bit more? Because I think that we need to make the community aware that this is not the end. This might be the peak of the situation that we need to address it more than ever. That we need to continue to take the healthy measurement that the government have addressed to the federal and state and local government. So can you please address a little bit more, make sure that we get more communication to that?
Absolutely. I'll be happy to share with you the leads in each category of special population we're working with. Those guys are working, so I also, if you've got communications for them, if you could work that through Dominic or myself, so we can make sure they're working. We've got a regular rhythm of communication with those teams. We also have a regular communication pattern with senior staff. Council President participates in all of those daily updates. So we're definitely trying to make sure you guys both have the information or aware of what's going on, and I'm happy to share that, Council.
Councilor Flynn.
Thank you, Council President. The question is for the Health Department and the Mayor. A few people have reached out to me. Obviously, social distancing is a big thing, not shaking hands and trying to stay away from, germ to germ. Anything with the bike rental and scooter program, I made a question about that earlier this week. I heard the scooter program, they were going to stop that for now, suspend that, so people touching the scooters and then the next person touching it. Is that true that it is suspended, and the same with the bike rental program?
Yeah, sure. I'll start, and Dave, you can chime in after. The scooter program has been suspended. They were out for a while though, for the weekend, I think for 4 or 5 days. They're having some difficulty in servicing those. Bike rental is still up and is available. And one of the reasons we have supported allowing these sort of micro mobility options up is to give people another way to get around. At present, most of the shuttles have been curtailed. Anything that Salem State or North Shore Medical Center was running. We know that folks are a little nervous about even using rideshare systems like Uber and Lyft. We still have college kids on campus. There's about 150 students that are still there who are some of the primary users of the bike and the scooter share system. So scooters are away, bikes are up. We are advising folks, as has Zagster, who runs the program, that if you're going to use any of those facilities, that you need to be mindful. They're doing extra sanitation and cleaning when they're servicing them, but it's not happening as frequently as an interchange between riders. So folks are advised, just like if you're using an ATM machine or a grocery cart or opening a public door, that you may need to have your own precautions with you, wear gloves or bring your own cleaning cloths. But the bikes are one way to get around. It's one of the few things you can do from a social distancing perspective, and not everybody has a bike. So we did want to leave those in place to enable folks to get out if they've got cabin fever or if they actually need it for a form of transportation.
Is there any way to make the bike rental company put some type of a cleaner or a sanitation station like they do in the supermarkets where someone can get a wipe? Because a lot of people don't carry them, the college kids, and you're taking the bike from location to location. Is there a way that we could do something like that, request it from the company?
Yeah, we can definitely look at it. I think getting a hold of those things are really hard right now. Any kind of sanitization wipes and their ability to stay there, but we can certainly look at what we can do. They did, if you're a Zagster user, you did get a message encouraging you to be mindful of, the fact that there may be additional precautions that riders want to take themselves.
All right, thank you.
Yeah, sure.
Anyone else? Councilor Dibble.
Thank you, Mr. President. I'd like to thank the mayor again and motion that we return to the regular portion of the agenda.
Thank you, Councilor Dibble. Council Sargent, do you have something to say, or you get your hand up, so I wasn't sure? No, you're all set? And I will just like to say, for everyone's clarification, once again, Mayor, thank you. But it's been 2 weeks since I first had to log on to a Zoom conference call with all the department heads, and I just want to let everyone in this group right here that's on my screen and everyone at home listening, how fast this whole process has evolved over just the last couple of weeks, and just being involved in those, taking a back seat and listening to what's going on and throwing in a question when I need to, and just taking in all the information, and how hard and diligent our department's heads and their staffs are working to ensure their safety and the public safety at every turn. I can't say enough for what I've seen and heard over these video chats over the last 2 weeks and how well they're doing. And I see Dave Greenbob sitting in his chair over there. Dave, after you hang up the phone, take a nap, because tomorrow morning starts early, my friend.
Yes, it does, Councilor. Thank you.
Thank you.
And Bob, can I just say we're really glad to have you participating in that. And I just want to say hats off to the team here. I mean, senior staff at every level has stepped up. People are cross-collaborating different departments. Everyone has really pitched in at every level. And I think it's the best of Salem coming together when we're up against it. And we're certainly seeing that. So I'm really proud of the team, and we're going to continue to work hard and try and get ahead of this thing.
Thank you. Councilor Dibble's moved to return to the regular portion of the agenda. Seeing no objection, we're back on page 3, public testimony. No one signed up in advance. Public hearings, none. Appointments and reappointments.
We have held from the last meeting the mayor's appointment of Felipe Zambolini to the Affordable Housing Trust Fund Board with a term to expire March 12, 2021.
I would ask Councilor Sargent to take the podium, and I'll step down, and I will say to Mr. President, I move to suspend Rule 29A.
Councilor McCarthy moves to suspend Rule 29A. All those in favor? All those opposed?
Thank you.
The ayes have it.
Thank you. I further move to for confirmation by roll call vote.
Councilor McCarthy moves confirmation by roll call vote. Madam City Clerk, please call the roll.
Councilor Dibble?
Yes.
Councilor Dominguez?
Yes.
Councilor Flynn?
Yes.
Councilor Hapworth? Councilor Hapworth?
Yes, tried the space bar, sorry.
Councilor Madore?
Yes.
Council Marcillo,
Yes.
Council Presnewski,
Yes.
Council Riccardi,
Yes.
Council Sergeant,
Yes.
Council Turio,
Yes.
and Council McCarthy.
Yes. Councilor President, if you don't mind, I'll take this since you don't have the sheet in front of you.
Yeah, thank you.
In the matter of the appointment of Felipe Zamboni to the Affordable Housing Trust Fund Board, we have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. Well done.
I think he might be here.
Yeah, it was, I further move to suspend the rules to allow Mr. Zambolini to speak if he so chooses. Can you fill it up? We're going to try it. If not, that's why we suspended Rule 29A, because he couldn't be here in person.
They said thank you in the chat.
He said thank you in the chat? Thank you. Further appointments and reappointments.
We have the mayor's reappointment of the following department heads with their terms to expire as follows.
Move to waive the reading.
Lisa.
Council Sergeant.
I move confirmation by roll call vote.
Council Sergeant moves for confirmation by roll call vote. Any discussion? Seeing none. Madam City Clerk, would you please call the roll?
Councilor Dibble,
Yes.
Councilor Dominguez,
Yes.
Councilor Flynn,
Yes.
Councilor Hapworth,
Yes.
Councilor Madore,
Yes.
Councilor Marcillo,
Yes.
Councilor Presnewski,
Yes.
Councilor Riccardi,
Yes.
Councilor Sergeant,
Yes.
Councilor Turio,
Yes.
and Councilor McCarthy.
Yes. Thank you. On the matter of the reappointment of the following, Lisa Camerata, John Giatti, Tom Daniels, Dave Knowlton, Tom St. Kathy Wynn. We have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. Further appointments and reappointments.
We have the mayor's reappointment of Sarah Moore of 34 Leach Street to the Board of Health for a term of 3 years to expire March 26, 2023.
Councilor Turio.
Thank you, Mr. President. I will apologize if I was pretty...
Unmute yourself. Thank you.
Assuming you can hear me, I move for confirmation.
Councilor Turio moves for confirmation by roll call vote. Under discussion, Councilor Turio. I actually, for the record, Councilor Turio's in the ante room. I can actually hear him. Councilor Turio moves as no discussion. Madam City Clerk, is seeing any other discussion? Seeing none, Madam City Clerk, could please call the roll.
Councilor Dibble,
Yes.
Councilor Dominguez,
Yes.
Councilor Flynn,
Yes.
Councilor Hapworth,
Yes.
Councilor Madore,
Yes.
Councilor Marcillo,
Yes.
Councilor Presnewski,
Yes.
Councilor Riccardi,
Yes.
Councilor Sergeant,
Yes.
Councilor Turio.
Yes.
Keep that as a yay. And Councilor McCarthy.
Yes. Thank you. On the matter of the mayor's reappointment of Sarah Moore to the Board of Health, we have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. Yeah, I can barely hear you. Further appointments and reappointments.
We have the mayor's reappointment of Sumner Jones of 8 Aswan Hill Drive to the Board of Trust Fund Commissioners for a term of 12 years to expire March 26, 2032.
Councilor Flynn.
Thank you, Mr. President. I move for confirmation by roll call vote.
Councilor Flynn moves to confirmation by roll call vote. Any discussion?
No discussion.
No discussion, seeing none. Call the roll.
Councilor Dibble,
Yes.
Councilor Dominguez,
Yes.
Counselor Flynn,
Yes.
Counselor Hapworth,
Yes.
Counselor Madore,
Yes.
Counselor Morcillo,
Yes.
Counselor Prosnewski,
Yes.
Counselor Riccardi,
Yes.
Counselor Sargent,
Yes.
Counselor Corio,
Yes.
and Counselor McCarthy.
Yes. Thank you, Maureen. On the mayor's reappointment of Sumner Jones to the Board of Trust Fund Commissioners, we have 11 members voting, 11 negative. The matter carries. Communications from the mayor.
We are in order that the sum of $250,000 is hereby transferred appropriated from the fund balance free cash to the general fund mayor's COVID-19 emergency fund account.
Council Terrio moves for suspension of the rules. I can hear him, but he's not coming in over his laptop. Council Terrio.
Thank you, Mr. President. I move for adoption.
Terrio moves for adoption. Under discussion.
No discussion beyond what we've already heard in the. This is the beginning of a long.
Any further discussion? Seeing none. Does this require a roll call? Councilor Dominguez has his hand up.
Yes, thank you, Mr. President. I have a couple of questions on this matter. I think that Councilor Debo asked a question to the mayor regarding how it's going to be used, these funds. And I have some information from some other cities and towns. They're receiving some funds from the government, from the state government, related to the needs on this crisis. So we would like to have some discussion before we move forward on this appropriation to make sure that everybody understands exactly what's from concern. So if I may, I would like to refer this to if Councilor Turriel approve it or not, refer to administration and finance so we can have some question answer.
If someone wants to suspend the rules, the mayor's still in her office, and I see her little icon still up on it. I will say for that they have been in the phone conversations. I know that Chief Junta in the fire department has been circulating overtime sheets and additional resource sheets to the different departments on what their expenditures, obviously to get money back on the rears of this. I mean, I think it's an accounting issue. I believe that the mayor's intent is to have the money up front and available in case the need of an emergency expenditure needs to be expended in order to get something done right away, as opposed to having us post a meeting and having a virtual meeting to come up with their city funds. So they're going to, if any monies are coming back from the state or the federal government, those monies would then be credited back and would show in the accounting of this initial $250,000. But I will allow the mayor to speak on this if seeing no objection. Mayor Driscoll.
Yeah, thank you. I appreciate the opportunity to weigh in a little bit more. We fully anticipate that a good portion of our expenditures will be reimbursed. That is typically what happens when you have a public emergency like this, but it does require us to expend the dollars. It's a reimbursement program. And I will say this is unprecedented. So this isn't a public health emergency that we've had before or seen before. But typically when there's a declaration of an emergency of this nature at the state level, at the federal level, there is a relief program that provides for reimbursement. We are tracking all of our costs related to COVID-19 response so that we'll be prepared to submit, like we have in the past when we've had natural disasters and other things where there were public declarations of emergency. But I do think it's important that we're able to move nimbly. When we need resources, we can't come back into the council and wait for a meeting or wait for a special meeting. There are going to be times when we need to outlay dollars and we need to move faster than we're going to be able to if we have to come back to the council. We're happy to provide an accounting of that. Obviously, these are still public dollars. They need to be expended in accordance with the laws that we follow locally. But we need a resource to draw on to purchase things and to provide for the additional costs we know we're going to incur. Looks like Councilor Dominguez, yeah.
Yes, thank you, Mayor. I think that's clarified most of my concern, but I also wanted to ask you, there is any time limit on the funds to come from the state? Because I hear that some cities and towns already receive allocation on that money. For example, I hear that Lawrence have already $100,000 from the governor to take care of some of the issues that they need to take care. So there is any indication that you have any idea when that money is going to come?
It can really lag. It depends. We're hoping we'll get some resources. The state did free up a few $1,000s for the Board of Health for public health and additional public health costs, monitoring expenses, things like that. But generally speaking, the state and federal relief that we get can lag months, sometimes 18 months behind. Now, what we're hearing in this unprecedented case, the federal relief program is saying they're going to be turning over resources within 30 days. You know, I guess I'd say I'll believe it when I see it, and we don't want to necessarily be caught short with the inability to fund things that we might need, and want to be able to press forward on this if necessary. So hopefully soon, but I wouldn't want to commit to a specific time frame yet.
Councilor President, then Councilor Dibble, then Councilor Medor. Councilor Presnowski. Councilor Presnowski, you need to unmute yourself. Thank you.
Okay, does that work?
That's perfect. Thank you.
Thank you. We're in unprecedented times over here, and our ability to react has to be spontaneous, and we should be able to have the funds to do that when needed immediately. I mean, we're talking about a situation where people's lives are at stake. We shouldn't be talking about dollars and cents at this point. If there's any criticisms to be made, how things are spent, then we can take a look at that later on down the road. But I think that our city leaders, who are doing an absolutely fantastic job of dealing with this, should have the ability to tap into resources that they think that they need right away. And I trust their opinions will be just. Thank you.
I concur. Councilor Medor, then Councilor Dibble. Councilor Medor. Yes, you.
Thank you, Mr. President. I thought I had someone else before me.
I goofed it up, but I'm sorry.
My question is through you to the mayor, whether there's a reimbursement cap from the state. Thinking ahead, if we need more than $250,000 and we add to this fund, is there a cap on reimbursement from the state?
We don't really know the rules yet around how they're going to treat COVID-19. Generally, if it's a public emergency, like I'm thinking of some of the winter storms or other natural hazards that have occurred, they reimburse 75% of certain costs. This one, I think, is going to be a little bit different, so I'm not exactly sure what the rules are going to be. I think, to be clear, I think we're going to spend way more than $250,000 on this as a result of this issue, but we just are looking for a pool of resources right now up front to try and make sure we're nimble and quick and able to purchase things as necessary. We'll obviously be back if we need more resources, or we'll be building that into the budgets, or hopefully we'll have state and federal relief coming to help offset some of these costs.
You all set, Councilor Medor? Councilor Dibble. Councilor Dibble, you need to unmute yourself. There you go.
Yeah, I did that a minute ago, but it clicked back on its own somehow. So be careful of that.
Wait a second, just for clarification, just for everyone's clarification, we mute everybody so you can unmute yourself, because if we leave everyone unmuted, you get all the background noise in the meeting. So that's why everyone, if you look at your icons, you'll all be muted. I can tell who's muted. So, but when it's your turn to speak, just unmute yourself, just for clarification.
Yep.
Councilor Dibble.
Thank you, Mr. President. I think there's a good compromise here. I fully agree with my fellow councilors Conrad Prosnowski and Dominguez. I think what we should simply do is, and I had a lot of the same questions with the letter that the mayor had written, where the $250,000 was not spelled out, not exactly, but not even spelled out at all what we were funding this for. But tonight, the mayor did an excellent explanation of some specific examples, and I think the money should be set aside and approve tonight, but at the same time, we should refer the matter to committee so that we can keep it in committee and to have the follow-up from the mayor on what the money was spent on. So let's get the money to the city, to the mayor, and to the departments now, like Councilor Prosnowski just said, but also to alleviate some of the concerns that Councilor Dominguez had. Let's do both. Let's put it in committee and let's approve it tonight. Thank you. So I guess I would like to ask Councilor Terrio to reframe his motion if Councilor Dominguez would like to withdraw his motion to put it into committee, is my recommendation.
I withdraw my motion, Council President.
Councilor Dominguez has withdrawn his motion. Now the motion is friendly amendment from Councilor Dibble would be to move for adoption and refer to the community, refer the matter of the fund to the Committee on Administration and Finance co-posted. Councilor Terrio?
So that's fine. Thank you, Mr. President. That's fine. The caveat here is that all this data is going to come to us in the subsequent financial reports for the next couple of months. So we will see this as it is spent. So we're going to get reports on all of this anyhow, but it's fine to put it in. If you want to do it that way, that's fine. We can approve it and refer it to committee, but it'll come in through the financial reports anyway. So
okay. Anyone else? Councilor Prosnowski. You have to unmute yourself, sir. Thank you.
Thank you. Just being a newer member of the council, does this in any way slow the process down at all so that the city leaders will be able to get the money that they need? I just don't want to. I don't want to see a monkey wrench thrown into it because it seems like you're having your. I'm just not sure whether or not this slows it down. And that's, I think, the most important part is that we're able to tap into this immediately. And I agree with the mayor that there's probably a good chance that this may be a low number. I'm hoping that it stays at $250,000. We'll be fortunate if that's all it costs the city for this.
Councilor, I agree, but I will say that by approving it tonight, obviously all the money will be made available. By approving and then referring to committee, it would be that if the mayor wanted to come in before the next, if 250 isn't enough, she could bring it to committee first before coming to the council and asking for another appropriation, or at any point she could, if there's a spreadsheet incurred, she could submit that to committee. So if that's the will, that's the will. But the first action tonight is we're going to move to approve, and then the secondary action would be then to send the matter to committee, co-posted. Is that correct, everyone? Everyone seen everyone nodding? Yep.
Thank you for clearing that.
No problem. Anyone else? On Councilor Terrio's motion that this matter be adopted and then referred to the Committee on Administration and Finance, co-posted. All those in favor? All those opposed? The ayes have it. Thank you.
Thanks, everyone.
Thank you, Mayor. Further communications from the mayor.
We've been ordered that the sum of $54,350.46 be approved within the retirement stabilization buyback account to be expended for fire personnel that is retiring.
Let the record reflect that Councilor Flynn has recused himself from this portion of the meeting. Councilor Terrio.
Thank you, Mr. President. I move for suspension of the rules.
Councilor Terrio moves for suspension of the rules. Seeing no objection. Councilor Terrio.
Thank you, Mr. President. I also move for adoption.
Councilor Terrio moves for adoption. On discussion.
No discussion. I wish Mr. Brennan a good retirement.
Me as well. Any further discussion? Seeing none. Councilor Terrio's motion for adoption. All those in favor? All those opposed? The ayes have it. I like the little, we see everyone right away. Further communications from the mayor.
We have an order that the sum of $6,603 is hereby transferred and appropriated from the free cash account to public property building inspection clean lien account.
Let the record reflect that Councilor Flynn has rejoined us. Councilor Terrio.
Thank you, Mr. President. I move for suspension of the rules.
Councilor Terrio moves for suspension of the rules. Seeing no objection. Councilor Terrio.
Thank you, Mr. President. I also move for adoption.
Councilor Terrio moves for adoption. Under discussion.
Thank you, Mr. President. Briefly, this is for the cleanup work that was done by North Shore Marine to take down the remainder of the poles at Palmer Cove Park that did not fall down, because we had one of them fall down on the morning of March 4th. Fortunately, nobody was injured. There was no damage to property, but it had completely rotted at the base, and we had a structural engineer go and inspect the remaining poles the next day, and his conclusion was that they all needed to come down. So that Friday, a work crew was contracted and brought in to take them down.
Thank you, Councilor. Any further discussion? Seeing none, and Councilor Torrio's motion for adoption. All those in favor? All those opposed? The ayes have it. Further other communications from the mayor.
We have a resolution authorizing the submission of a statement of interest to the Massachusetts School Building Authority for the Salem High School.
I'd like somebody to move to waive the reading, please.
Yeah, we're definitely waiving the reading. Councilor Torrio.
Thank you, Mr. President. I move for adoption by roll call vote.
Councilor Torrio moves for adoption by roll call vote. Under discussion, Councilor Torrio.
Thank you, Mr. President. We are looking once again for money from the Mass School Building Authority for funds to do renovations at Salem High School. This is a statement. By authorizing this, we are agreeing with the school committee that there is work needed there, and we're going to see if the School Building Authority does in fact authorize funding, at which point we'll figure out and separately authorize any math there. This is the beginning of the whole process, where we tell them that we are interested in doing this, and then they tell us if they're interested in helping us pay for it.
Just trying to get into the queue, that's all. Any further discussion? Seeing none. Madam City Clerk, will you please call the roll?
Councilor Dibble?
Yes.
Councilor Dominguez?
Yes.
Councilor Flynn?
Yes.
Councilor Hapworth?
Yes.
Councilor Madore? Councilor Marcillo?
Yes.
Councilor Presnewski?
Yes.
Councilor Riccardi?
Yes.
Councilor Sargent?
Yes.
Councilor Torrio?
Yes.
And Councilor McCarthy.
Yes. Thank you. On the matter of the adoption of the MSBA Statement of Interest for Salem High School, we have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. Further communications from the mayor.
We have an ordinance amending traffic chapter 42, section 88, speed zone regulations for Valley Street.
Councilors Flynn and Madore, or should that be Riccardi? I mean, Marcillo. I'm not sure what section of this is, but we'll start with Councilor Flynn, since he's listed first. Councilor Flynn.
Thank you, Mr. President. This would all be in Ward 4. I'm not sure why they have another counselor on that with me. But basically, I heard from Lieutenant Tucker with the police department traffic, and he's been working with Dave Kuchowski from traffic at the city. And what they're basically doing is right now, Valley Street, as it stands, is supposed to be posted as a 25-mile-an-hour speed limit for about 0.2 of a mile on each end, and it's supposed to be 35 miles in the center. These regulations were approved by the Mass DOT back in 1975. So they're trying to straighten this out. In the DOT, they have a certain formula and a study that they do, and they had to try to approve to get this down as low as they could. I'd like to see it 25 all the way through, but the best that they could do with the DOT is getting that middle part down to 30 miles per hour. So they don't want people to think that they're seeing a 25-mile-an-hour speed limit in the center part of Valley and it's going up. It's actually going down. It's been posted wrong for many, many years. So they were just trying to correct this and put the correct signs of where they're supposed to be. And this was the lowest speed limit that they could get through the DOT is 30 for the center. And that's pretty much the update that I have on that.
Thank you, Council. Any further discussion? Seeing none. On Councilor Flynn's adoption for first passage, all those in favor? All those opposed? Mayor's informational page we already took up. Motions, orders, and resolutions. Councilor Riccardi.
Thank you, Mr. President. City of Salem, City Council regular meeting in the year 2000, March 26th in the year 2020, an ordinance to amend an ordinance relative to traffic, be it ordained by the City Council of the City of Salem as follows. Section 1, amending Chapter 42, Section 49, obedience to isolated stop signs is hereby amended by adding the following: Osborne Street northeasterly bound on Osborne Street and Walter Street, Osborne Street southwesterly bound traffic on Osborne Street at Walter Street. Section 2, this ordinance shall take effect as provided by City Charter. I move for adoption by first passage.
Thank you. Councilor Riccardi moves for adoption by first passage. Under discussion?
Thank you, Mr. President. This has been a request that I've been hearing a lot from a lot of the neighbors. It was submitted around mid-February. Unfortunately, a week after submitting the request to Lieutenant Tucker, an accident occurred at this very intersection. So, I think this is needed, and unfortunately, it will take 2 passages to get done.
Thank you. Any further discussion? Seeing none on Councilor Riccardi's motion for adoption for first passage, all those in favor? All those opposed? That carries. Further motions, orders, and resolutions. Councilor Riccardi.
Thank you, Mr. President. City of Salem, March 26, 2020. City Council regular meeting in the year 2020, an ordinance to amend an ordinance relative to traffic, be it ordained by the City Council of the City of Salem as follows. Section 1, amending Chapter 42, Section 49, obedience to isolated stop signs is hereby amended by adding the following: Walter Street northwesterly bound traffic on Walter Street and Osborne Street, Walter Street southeasterly bound traffic on Walter Street at Osborne Street. Section 2, this ordinance shall take effect as provided by City Charter. I move for adoption for first passage.
Councilor Riccardi moves for adoption by first passage. Under discussion, Councilor Riccardi.
Thank you, Mr. President. This is the same intersection. When we were researching the additional stop sign, we realized the other stop sign was not solidified by ordinance. So we are doing that with this.
Thank you. Any further discussion? Seeing none on Councilor Riccardi's motion for adoption for first passage, all those in favor? All those opposed? That carries. Further motions, orders, or resolutions? No one. Thank you. Committee reports, none. Communications from city officials, none. Petitions.
We have a request from Salem Main Streets to hold the Salem Arts Festival in closed Front Street on Saturday, June 6th, 10 a.m. to 9 p.m. and Sunday, June 7th, 10 a.m. to 7 p.m.
Councilor Madore.
Thank you, Mr. President. I move that this be granted.
Councilor Madore moves this be granted. Under discussion, Councilor Madore.
Yes, thank you, Mr. President. Obviously, we're taking the current situation one day at a time and really hope that we can still have this wonderful festival, the Salem Arts Festival, continue. And if not, we will adjust accordingly. But when this petition was filed, it was in early March, I believe, or well before the closures that had started. And the only difference from previous years is that the length of time for Front Street to be closed to traffic is beyond 6 p.m. and also for both days, just to improve the safety for festival attendees. And I'm not sure where the festival will stand, but I hope that for folks who are listening and watching tonight, and if we can still celebrate the arts in Salem come June, I encourage everyone to come out and support local arts and our businesses. Yeah. Thank you.
Thank you. Any further discussion? Seeing none on Councilor Madore's motion that this matter be granted, all those in favor? All those opposed? Matter carries. Further petitions.
We have a request from Wreaths Across America and Cushion Amusements to hold a carnival on June 18th to June 21st, 2020.
Council Sergeant, can you take the control for a second?
Yes, I have the chair. Chair recognizes Council McCarthy.
Thank you, Council President. I move that this matter be granted.
Under discussion.
Thank you, Mr. President. On discussion, I mean, obviously, as Councilor Madore just stated, these applications came in well in advance of everything we're going through, and as we all know, what we're going through changes by the hour, if not by the minute, sometimes on what we can and cannot do. I will say for the record, I was at the Park and Rec meeting when this matter was approved at the Park and Rec level. They put a long list of requirements and safeguards in place about, with regards to stop times and when they can be dropping the equipment off and assembling it and disassembling it. And I know that they have to adhere to those. But I would move to be granted, obviously, that knowing that at some point we may have to notify them if we're still in the midst of this thing, that it might not be able to happen. But at this point, my motion would be to grant.
Any further discussion? Being none, I can't see everybody, but can you say everybody, Council McCarthy? Any further discussion?
Yep, I got them all.
Okay, being none, on Council McCarthy's motion, this be granted. All those in favor? All those opposed?
Thank you. Further petitions.
We have a list of the following license applications for limos taxi operators.
Waive the reading.
Thank you, Councilor. Councilor Madore.
Thank you, Mr. President. I move that these be granted.
Councilor Madore moves they be granted. Any discussion?
No discussion.
Seeing none, on Councilor Madore's motion that these matters be granted, all those in favor? All those opposed? Matters granted. Further petitions.
We have one claim and one subrogated claim.
Councilor Madore. Councilor Madore, you need to unmute yourself, please.
Thank you, Mr. President. I move that these be referred to the Committee on Ordinances, License, and Legal Affairs.
Councilor Madore moves that these matters be referred to the Committee on License, Orders, and Legal Affairs. Seeing no other discussion on Councilor Madore's motion, all those in favor? All those opposed? Matter carries. Unfinished business.
Through the second reading of an order to amend the rules and orders of the City Council by adding the following. Ordered Section 36 of the rules and orders of the City Council be amended by deleting a reference to Cushing's Manual and inserting the place thereof Robert's Rules of Order.
Councilor Madore.
Thank you, Mr. President. I move that this be referred to the Committee on Ordinances, License, and Legal Affairs.
Councilor Madore moves that this matter be referred to the Committee on License, Order, and Legal Affairs. Seeing any other discussion?
Second.
Seeing none, seconded by Councilor Sargent. All those in favor? All those opposed? The matter is referred to the Committee on License, Orders, and Legal Affairs co-posted. Before I recognize Councilor Sargent, I just want to thank everyone this evening for our first endeavor into a virtual meeting. I can only hope, I mean, that I know it's not going to be our last, but I hope it's not one of many, many, many. But I want to thank you all for your patience. And I now recognize Councilor Sargent.
Thank you, Council President McCarthy. Again, thank you, everybody, for, especially myself, for getting through this. I couldn't imagine doing this 20 years ago when I started. I move for adjournment.
Councilor Sargent moves for adjournment. Seeing no discussion, all those in favor, all those opposed, we stand adjourned. Thank you very much. Remember to click your leave meeting button.
Ready?
Thank you.